Hi, everyone. Adnan Iqbal here, and welcome to another amazing episode of Digital Health on Air. Super excited today to be joined by Jackie Kimmell. Jackie supports research and thought leadership at Rock Health. She is the author, so we have an author for the very first time, or maybe not, but I think for the very first time. And she recently authored the book, The Privacy Prescription: Why Health Data Privacy is in Critical Condition and How to Fix It. So very, very relevant to our audience here and everyone across the spectrum of healthcare and healthcare technology. Prior to Rock Health, she was a senior director of market intelligence at the Health Management Academy, another one of our friends and folks we think highly of. And so today she's going to really share with us her insights and the very timely, relevant, impactful insights around uncertainty in the current climate, especially as health organizations think through regulatory, financial, and technological change, or at least like, hey, what's going to happen? So very, very excited to have you, Jack.
Thank you so much. Lovely to be here today and to talk with you.
Awesome. Well, I'll start with an open-ended question, and you think of it as a warm-up, and then we'll kind of dive into like the heart of things and really your area of expertise. But tell us about your work.
Of course. Yeah. So, I think as I think about my career, I've kind of vacillated between two areas. I've focused on health system innovation and then value-based care innovation. And so you'll notice I use the word innovation in both. I'm really fascinated by how can care change because I think it needs to change. And I'm particularly fascinated by, is it technology that makes those changes? Is it care model changes, payment changes, or a mix of all three, which I think is probably the right answer. But I think I would describe myself as a data nerd and healthcare nerd, and I love digging into some of these topics. So you mentioned the book that actually started very much motivated by having my own healthcare data hacked while I
Mm.
was in an extremely vulnerable position, which was hooked up to an IV in the hospital. I
Oh my
got an
goodness.
email about a breach notification. Luckily, I was just getting, some iron infusion, so nothing too serious. But I felt so vulnerable in that moment, and I think it really inspired me to want to think about, okay, we're doing all of these amazing things with technology in healthcare, but what are the potential downsides of that? And how do we do that change, that innovation well, so that we're not putting patients at risk and making them feel, vulnerable or uncertain in their data or in anything else, their care model, their provider relationship, anything else that is so human and impactful to them.
Awesome. Well, you're in good company here. We too are data and healthcare nerds.
I love it.
And what you just articulated is obviously a very noble and important calling, especially as we think of healthcare today in a space that is very fluid, right? And I think in a lot of ways is going to go through some um, seismic lasting shifts here, right, over the next
Yes.
half a decade and decade. So let's shift there. Things are changing, things are fluid. Timestamp us a bit. Talk to us about the healthcare climate today and really why are healthcare organizations feeling this sense of uncertainty when truthfully healthcare has been probably one of the oldest professions in the world, and health systems as we know here in the United States and its kind of current formulation has been around for many, many, many decades, kind of post World War II.
Yeah. Yeah. I mean, I think the word you used is perfect, which is uncertainty. There many of these systems. In my last role, I worked closely with chief strategy officers. So I was talking with chief strategy officers every day. And many of them are coming from these storied health systems that you mentioned, where they've been around for hundreds of years, if not decades, and have this really lasting legacy. Most of them are deeply scared about what is coming. There's kind of a joke within CSO circles of there's what they call the oh no slide, which is what they put in front of their board very judiciously. And the oh no slide essentially maps out the workforce, it maps out rising demand from patients, and it maps out payment shifts, shifts to payer mix, shifts with government reimbursement. And it does not look pretty, as the title implies. Essentially, we don't have enough uh, of a workforce to meet rising demand, and health systems are not going to have enough money to be able to provide that care into the future. And so I think you know there's already kind of this deeply rooted fear about what is coming in the next decade, and can even these storied health systems with names that, are adorn multi-story buildings around the country, can they survive, let alone smaller provider groups? And then you add to that a lot of uncertainty recently, especially from a policy and regulatory standpoint, where we have, these two new leaders of HHS and CMS, in RFK Jr. and Dr. Oz respectively,
Mm-hmm.
and real questions about, are they going to make major changes to the system that could further destabilize what is going on for these healthcare provider organizations? And beyond that, right, you think about if there was a trade war, tariffs, all of these impacts deeply impact healthcare, the supply chain, what they can expect, as well as from a labor perspective. 1/6 of nurses are foreign born. So starting to think about changes to labor pipelines with
Mm-hmm.
visa changes or anything else that's happening. Everything that's happening within the broader kind of political landscape has deep impacts for healthcare organizations at this pretty tenuous moment.
Well, look, I think you're leading me exactly where I wanted to go. We have global level changes, macroeconomic changes, and then of course, if you look at it with the health system lens, there's changes to workforce, to demand, to their reimbursement and payment landscape. You talked about policy, and so I'd
Yeah.
love to dig in there because that's often, I think you're right. Like most boards now, I've seen a no slide, but what we get the sense of as we spend time with health systems on all across the country is like the policy side is still there's not a slide on it, right? Or
Mm-hmm.
if there is, it's pretty broad brushstroke slide. So let's double click there. There's
Mm-hmm.
policy uncertainty. Like what do we know today? And how should health system leaders, regardless of what part of the health system they sit in, how should they be thinking about it in terms of their go forward plans and operations?
Mm-hmm. It's a great question. Yeah. So I think you're exactly right that we don't know a ton yet. We know what these two leaders have said in confirmation hearings and even before, right? They've penned
Yes.
op-eds, they've been on TV, both of them quite a bit, and shared ideas. But we truly don't know what the impact is going to be of many of the changes that they're proposing and whether they'll go through with them. I think a great example of that is some proposed changes that RFK Jr. has talked about making to the RVU, or the relative value unit system. Many will know that he has reportedly, I think the Washington Post broke the story, talked to many senior officials about completely changing the RVU system, which, this is for us healthcare nerds, something that would dramatically change revenue cycle, would change all of provider payments, would essentially shift the entire way that providers could be paid, and basically wrestle it away from the American Medical Association, which has been doing it for decades. Who knows if he will actually do that, right? I think there's no great sense today of whether that will happen. And I think that is what's deeply concerning for so many health system leaders, because that could have huge changes to payer mix, to revenue cycle, to financial projections, to the medical group, the way it operates, everything. And yet we don't know if it's going to happen. So, I think what's important to focus on is what is certain and what is not certain, maybe reading the tea leaves a little bit for health system leaders. So I think what is certain is there's going to be more of this kind of focus of make America healthy again, and this sense of preventative medicine, and probably more of a focus, I would say, on food as medicine.
Hmm.
I
Hmm.
was actually just recently at a food as medicine conference, and there were double the number of payers there that had been there from previous years. So I think most people are getting the message that, okay, they're going to have to do something around food as medicine, and more of that preventative lens. I think there's going to be a shift away from kind of these broader value-based models coming out of CMMI, the broad primary care-based models, to more mandatory specialty bundles. We know that that's a shift that they're wanting to make. I think there's going to be definitely a lot of changes to the workforce pipeline from a visa perspective, and providers are going to have to think about what those changes are going to be. And then I think we can expect a lot less regulation on AI in healthcare than we might have expected with the previous administration. I think we've seen already that a lot of the AI, regulation is going to come from large tech companies, and that's kind of who they want to be doing a lot of the policing of AI in this administration. So it's going to, in my mind, fall much more on health systems to decide how they want to implement an AI, how they want to regulate it, rather than from some external force. What is less certain is all these other changes, right? What does it mean for RVUs if they change? What does it mean for, broader, deep cuts to Medicaid, to Medicare? What are all of these other changes that have been mentioned kind of offhand, and we don't know if there's going to be really sustained, lasting impact, let alone the public health impact of changes to vaccines, to gender affirming care, to all of these other places where we're seeing some pretty substantial changes. So I went through a lot there, but I think my overarching advice is focus on what's certain and what we're starting to see, and then be braced for changes with everything else.
That is sound advice. And this is fascinating. I love how you've given specificity to really the slide title here is uncertainty with this area that are slightly more certain than uncertain. Be it food as medicine, obviously the workforce changes, some level of changes to payment bundles and AI regulation. Uh, I want to shift to we can go from TBD to GTH, like going to happen. Like we know workforce challenges, like everyone understands workforce challenges, everyone understands demand. In your just observation and experience, how are you seeing people tackle that? Like, are there net new novel things that health system leaders are doing for an area that there's certainty in, that they're just not going to be able to meet demand in the way that they're staffed today?
Yeah, I mean, I think every health system is doing something here. The question is, how well is it working and how well will it scale? Because the problem is these are long-term solutions and we have
Absolutely.
short-term challenges, right? So it needs to be a mix of both strategies. The problem I think now is some of the short-term solutions are the ones in jeopardy, which is, yeah, you can go to the Philippines and get many nurses to come over. That's going to be a little bit more challenging. I think on a long-term basis, there's a lot of efforts to build pipeline to get people excited about STEM. I don't think I know a major health system that does not have at least one partnership with a high school or a community college that is trying to, at least in their market, in their community, get people excited about working in healthcare. But I think some of the most innovative systems, in my mind, are those that have actually, in the last few years, gone through every single job description that they have and figured out what are the requirements that are actually necessary for doing that role. Because, we've all looked at job descriptions and they often have so many superfluous things on there that
Yeah, absolutely.
People feel overwhelmed and they don't apply to it. And they've really sat down and mapped, okay, what are the skills that are necessary? What is the experience that is necessary? And what could we frankly do without or train on the job? And they've really kind of taken a scalpel to a lot of the job descriptions and thought much more broadly about, does someone even need a college degree? Do they need a high school degree to do these jobs? Just to be able to broaden the pipeline, and then doing a lot more on the job training to try and fulfill those positions. I think that's, in my mind, the right solution between those longer term pipeline of getting high
Yeah.
schoolers excited and the shorter term of what do you do in right now.
Cool. No, it's super interesting. And I guess follow-up question, like, are you seeing some folks have success with this model? I think this is like very, very innovative and impactful. And like I said, it doesn't have that long tail impact. This could be impact now and in the next 36 months.
Yes. Yeah. I think there has been a lot of success. And I think it's fine to mention this. I believe Cleveland Clinic was one of the first to do this. They have, as I understand it, seen fill rates rise by 20, 30% since implementing some of these
Amazing.
strategies. And I think, many other systems will follow doing so.
Yeah. Okay. That's real ROI, and that's proof in the pudding. I will shift, or we'll shift together here
Mhm.
slightly. Um, Going back to uncertainty, but let's talk about financial uncertainty for health systems.
Mhm.
And um, how could an award-winning podcast right now not talk about AI? So they have financial uncertainty, but they're also then being tasked, I think, for the right reasons, to think about how do you invest in an AI? How do you invest in AI? And
Yeah.
so you've done a bunch of research in this area. Like, what are you seeing? Where are you seeing investments being made? And how are folks grappling with this now, understanding that they're not going to get to control the regulatory and compliance aspects of it?
Yeah, yeah. So, AI investment in the last 2 to 3 years, as you have seen, has been tremendous. I think every health system has rolled out AI on a broad, at least some sort of ambient listening
Hmm.
technology, I would say,
Absolutely.
for their providers in the last year, and we're just seeing use cases spike dramatically across the board, to the point where I think some of the early results that are coming out are so exciting. The recent JAMA paper that came out about Kaiser's
Hmm.
success with some of the ambient listening just shocked me in terms of the number of hours saved and real
Absolutely.
decreases in both provider burnout and in patient experience, which I think is such another important thing to bring in, to not have their providers staring at a computer the entire time.
Absolutely.
So, I think tremendous excitement coming out. I think what is very challenging is the change management piece of this. And this is where I think most health systems are grappling now. If you think about the curve of excitement about adoption, I think we were kind of at peak excitement a few months ago, and now we're coming into some of the challenges, especially with change management from a provider perspective. And so I've been doing a lot of work at Rock Health in concert with the American Academy of Family Physicians. And so we
Mm.
surveyed 1,200 primary care providers across the country and essentially asked them what they thought about AI, were they using AI, how did they think it would change things. And the data was super interesting. I highly recommend everyone read through the data in more detail, but at a high level, most of them were very excited about the impact on their well-being, on burnout, on patient satisfaction. Most of them were very bought in. Many of them were using AI. Most of them who were using it daily. So huge adoption very quickly. But what stuck with me in the survey is 63% of them said that they felt like they had no control or limited control over what AI would be adopted for
Mm.
them. And I think that really speaks to what was also apparent in the survey, which was a lot of fear about legal liabilities, medical liabilities, ethical guidelines. They kind of feel like they're getting this technology, they're excited about it, it's making a difference, but they don't have all the tools that they need
Mm.
yet to, you know, be able to implement it in the best way. And they don't feel like they're in the room with these decisions being made,
Yeah.
and those decisions are being made at the health system level, at the executive level. But I think it showed me a real challenge in the change management process in terms of getting providers bought in. And of course, that's just from an MD perspective. I think you see this much more with nurses,
Totally.
where most nurses, survey after survey, are excited about AI, but they don't feel like they're being asked how to use it. And then you're seeing huge strikes like what's happening in California against the use of AI specifically in healthcare, and feeling that a lot of fear about it. Whereas you do see, the second in survey after survey, that nurses feel bought in, they're excited about it, but otherwise they have a lot of fear about it
Yeah.
taking their
That's
job.
interesting, right? Like they're bought in, but they're protesting against it because they don't have a sense of control or
Exactly,
influence at
exactly.
minimum.
Yeah, I think that's a
Yeah.
perfect way to put it. I think it's a lack of control or influence, and so I think there's a huge missing middle right
Mm.
now of, okay, the adoption has happened, but how do you get people who are actually using this on board
Yeah.
with using it? Because otherwise the ROI is not going to be there long term.
Well, for our health system executives who are listening and tuning in, like there's clear advice here, like tangible advice. And change management's always hard. Providers, we know certain parts of the healthcare administration will say are like always challenging, but I think there's a moment here where this is transformational in so many ways that you got to
Mm-hmm.
listen to the folks who are going to
Mm-hmm.
be at the front lines of using it and hopefully and ideally using it effectively.
Mm-hmm. Agreed. And I think there's really good models here, right? I think it's the change management models that have worked for decades, right? It's getting physician champions, different members of the medical group who are excited about it to bring their peers along. Because I think that peer-to-peer
Absolutely.
change management works so much better than, even 100 town halls from the leader talking about the advantages.
100%. 100%. All right. We talked a lot about challenges, headwinds, uncertainty, triple underline uncertainty during our conversation here together. I am a glass half full person. And so I'd love to hear from you. What's the upshot here? Like you do a lot of research, you have a lot of conversations with health system leaders all across the country. Change is happening. Like is there some light or broadening light at the end of whatever tunnel that we're going down?
Yes, I will always end with the optimism here. I think, I think AI is probably my answer. I think we're in a moment where in the last 2 years, we have seen this technology come out, be adopted, and make major impact really quickly. And that doesn't happen in healthcare very often. We all know how
Hmm.
slow
Yeah,
healthcare
we
is
still
to
have fax
change.
machines.
Exactly, the perfect example. And so the fact that we're seeing these major changes and seeing, you know, physician really embrace this technology and be excited about it. And we're actually seeing rates of burnout decline for maybe the first time I've seen in 30 years. I mean, I think that is deeply exciting and a really good place to anchor some of our enthusiasm and excitement. And then, I think political views aside, let's think about a new administration coming in and the potential for change and for new approaches to healthcare. I think we can talk a lot about headwinds of things changing and how scary and hard that is, but I think many people are excited about making preventative care more important, about having more of that functional medicine, integrative medicine, those types of pieces. you know this could be really scary in terms of what happens. It could be really disruptive, but I think it's always exciting when there's going to be a change to a system that we know doesn't work well for most Americans, and I think it's exciting to think about, could there be advantages in that system and in those changes as well.
Absolutely, absolutely. Okay, we this has been super interesting, and I know I have like all sorts of light bulbs going off, so incredibly thought provoking. I'm going to take the opportunity to ask you like, where is your research focused on next? Like, do you already know your next book title?
I wish I did. One thing I'm particularly fascinated on, and I want to focus on next, is AI enablement of clinical decision support. I think that is one of the most fascinating areas. And there's so much that has happened even this year in
Mhm.
2025 with, a bridge partnering with UpToDate, for instance, all and open evidence getting all of the back catalog for the New England Journal of Medicine going back to 1990. There's some really exciting things that are coming with clinical decision support, and especially having it be queryable through AI in a way that is so much more efficient for providers to use. I think in my mind, and this is maybe being a little provocative, but it's a dirty secret in healthcare that care is not standard,
Mhm.
right? That even within the same practice, the same medical group, depending on who you see, the care is very different. It's very dependent on how recently that provider trained, whether they had an extra 2 hours on Sunday to read through a medical journal, or they had a kid's soccer practice. I mean, you think about just all the variation and clinical variation in care
Absolutely.
that's out there. And so the idea that AI could drive a lot more kind of standardization, and even beyond that, just the newest greatest science getting out in a better way, I think is
Yes.
really exciting. And I think making clinical decision support less of a check the box and epic, and actually much more of a, here's something you can engage with that links into your notes from the visit. I mean, I think this could really change a lot of the way medicine is practiced. So that's where I'd like to focus next, and
I
I'm
love it.
aiming to do so.
I love it. I'm looking forward to your research there, and most importantly for like the impact that's going to have on care for all of us, where we can trust that it's going to be high quality care, and there's an AI co-pilot there that's helped made that happen.
Yeah, agreed.
Awesome. Well, it's clear, Jackie, you and I could talk for hours, and I would ask you question after question after question. But I'm getting the yank here that we are at our time. This has been awesome. Like, thank you, one, for the research you do, because it's clear that the insights you're driving are rooted in real data, and not just data, but like the insights that you can then drive from it. So thank you so much for sharing your time with us and the incredible, like, tangible advice, and then really clear food for thought for our audience. So thank you very much.
Yeah, no, thank you so much. This has been wonderful to chat with you and really appreciate the time.
Awesome. Bye, Jackie.
All right, bye. Thank you.